Good morning and welcome to your second annual Discover Your Possible. I'm Robin Yoder, an above-knee amputee and the founder of Discover Your Possible. And joining me is David Lawrence, CEO and founder of Mission Gait Foundation.
Good morning, Robin, and welcome to everybody this morning. I think we're going to have a great day. We're going to share a lot with you, and I hope you're going to be inspired with so much of the content from today. So let's get started. Robin, tell us a little about what exactly is Discover Your Possible.
Discover Your Possible, it's a one-day skills and activity clinic geared towards amputees with lower limb amputees. It's also a day that we're going to join with highly trained, skilled clinicians that are going to teach all of us in our community skills from fundamentals to high-level activities, led by these awesome physical therapists that anywhere from complex gait that are. We are live. Sorry about that. So they're going to teach us anything from highly skilled activities, fundamental skills under a trained, controlled environment, all sponsored by Mission Gait Foundation.
Yeah, so the Mission Gait Foundation, then, just so everyone understands what that is, it's a 501c3 charitable entity. But more important than that, it's a progression of an idea. 30 years of working towards something that wanted to create more than was out there in the community. So 30 years ago, I was lucky enough to go to the University of Miami, met a guy named Bob Gailey. Bob Gailey is a guy who deserves a lot of credit for much of what's happening today in rehabilitation towards patients with prosthetics. Kosi will be able to talk to you later a little about her own experience learning from Bob, but he really got us started. And coming out of Miami, then I came to Richmond through the McGuire VA Hospital on a service obligation. And at that point in time, went from just kids with prosthetics into really seeing the guys coming back from Desert Storm with blast wounds and all the different injuries, as well as the older amputees. So kind of getting that mixture of different types of what the large scope of patients who had great needs. Went on to Sheltering Arms, and there I got a lot of experience with, as in Robin's case, with cancer and the issues of limb loss secondary to cancer. And again, brings in another wrinkle, a different aspect of what we have to be concerned about in the rehab community. So that progressed us along this idea from our Walking Free program internationally. We have centers around the world because I realized there are so many places in the world where they just don't have opportunities at all. So trying to bring those opportunities to them. And then back in the US, how do we improve the educational system? And that's really what it is. Get away from a spine and sports thinking and into a thinking of patients who have complex issues. How do we give them the resources to be successful? And that's what Mission Gait is about. So with that being said, Robin, give us a little bit about how Discover Your Possible came to be.
The idea truly came about as I was going through my own recovery from amputation and my own rehab. As I was moving through, I began to notice why were there people coming to this clinic from different localities, and some people were really traveling from significant distances. So I began to ask David, who was my physical therapist, why was that? And at the time I was really naive in my understanding and thinking that everyone was receiving the same level of high-skilled training and prosthetic gait training that I was. And through my questions, David began to educate me and inform me that that really wasn't the case. So a little further into the future of my recovery, Mission Gait was formed, and David approached me and asked if I'd be willing to be the voice for amputees on their board, and I certainly accepted that graciously. So as I began to think about that same question, as why are people coming to from these other locales to our clinic, I approached him with this idea in the Mission Gait team of, let's bring together a day that can encompass all of the activities and all that Mission Gait and all the special qualities that Mission Gait has to offer this community, and form a day the community comes together, and we're bringing amputees, we're bringing caregivers, we're bringing rehab clinicians together, and form this wonderful day called Discover Your Possible.
All right, so with that then, we kind of come to this idea of what is Mission Gait about, and the idea is empowering, right, the healthcare community, the rehabilitation community, professionals through education and research to do a better job. And by professionals, I don't just mean physical therapists and doctors, the patient. As I've said to Robin all through this process, I do her a disservice if I don't teach her everything I know, so at the end of the day, she's her best advocate. She's her best educator. She is part of the rehab team, and I think that's part of what we're about. So much of healthcare becomes funneling people to one location and saying, we're the experts, you should come to us. And that's really very limiting as to who can make it to you. So my idea is to really turn that funnel over and take all of our information and disseminate it free of charge to anyone that wants this information, so that no matter where you are in the country, you can get the same level of care, or at least the same access to the level of care. And that's if you're a therapist, if you're a patient, if you're a doctor. All of those resources come out available to you through our idea of empowering individuals through training, through education, and through research. So what exactly, Robin, are people going to see today? What's going to happen today?
All right, well, today, because of COVID-19, Discover Your Possible will look a little bit different this year. We're unable to meet in person, but I assure you this Mission Gait team of Tracy, Will, Holly, and David, and our guest speaker, Kosi, have adapted to our current challenges of the day and have put together an impressive skill, education, and supportive virtual pack program that's going to connect us to a larger community of like individuals from all around the world, live streamed on Facebook Live and YouTube channel. So how cool is that? Today there'll be something for everyone, regardless of where you are in your journey. My challenge to you today is to embrace this program today with a sense of curiosity, a sense of adventure, and a sense of wonder for what is possible. If you're a new amputee out there, see this as a glimpse into your future and understand the progression of skill sets that will allow you to reach your goals. And know that it's really hard and that it takes time. If you're a highly active amputee, please look at this and find something new and challenge yourself with that. If you're a caregiver, we haven't forgotten the important role that you play in our lives as well, in our recovery. So there'll be something for you later in the afternoon. But also observe and see what is possible and so that you know how to support your loved one. And if you're a clinician or a student out there, please see this with the same sense of wonder and curiosity to learn something new or to be able to share and rephrase the same set of skills with your patient. But all in all, let's all have fun today because that also is important.
And that is so true. I think something you said there really important is that sometimes people get a misnomer that you can, this is going to be easy. It isn't. The process is going to be difficult. Sometimes my doctor said he's going to get a prosthetic and I'm going to run out the door. That just doesn't happen that way. Success stories are amazing and the things you can accomplish are absolutely amazing, but you need a good team behind you. You have to have the right attitude and a willingness to work hard, but a team that's going to be with you through thick and thin, because there's both thick and thin, and Robin will tell you that. And that means that you're a doctor, you're a practitioner, you're a therapist, and you have to be a team. You have to be on the same page. I think that's so important. One thing I'd like to say, though, just as we kind of wrap things up here at our intro, is that we're in front of the camera, and there's a lot of other people in front of the camera today, but the success of this program is due to the people really that have put this together. So Robin and I are, again, the face of this, but I can tell you, Will Riddick, Tracy Rock, Holly Thornton, our administrator, Holly, Tracy building all of our educational materials and our certification program coming behind this, and Will, our kind of research guru, genius guy, as well as Tracy's a genius. They're both creative geniuses. Are really we have to thank them for what's going to happen today and everything you're going to see. So we appreciate the work that they're doing.
So lastly, none of this could be possible without our sponsors, so we need to thank the following. I want to thank the Mission Gait Foundation, the Mission Gait staff, Lawrence Rehab, the Gait Center, Kosi Talks, Kosi Bayoso, Hanger Clinic, PAL Orthotics and Prosthetics, along with our partners, Less Leg, More Heart, and Sportable, Richmond's Paralympic Sport and Recreation Club. So David, unless you have anything else you want to say, let us step aside so you can discover your possible.
Please do.
I'm Becky Thrift. I'm a left above knee amputee, and I love to ride motorcycles. My partner and I were on our way out to dinner. He had met me halfway up the road because we were going to leave the next day with a bunch of friends and go to Bike Fest in Maryland. We had just left my girlfriend's house. I think we hadn't been gone 2-3 minutes. And a person who was texting and driving in a truck hit us and killed my partner. I lost most of my whole left side on amputation. I got a full hip replacement. I have 2 metal plates in my pelvic, and my hand is put back together with a missing finger. It was months before I even knew who I was. The first thing I remember is them telling me to get out of the bed and stand up. And I wouldn't. I cried. I told them, leave me alone. I mean, I was in full depression, plus the pain meds that you're on from healing. So when they would take me to the lunchroom every day and we'd work and we'd do physical therapy, work out. And she told me I couldn't leave until I took that walker and walked that whole the whole area of the lunchroom. That's the only way I could do it. So I started, and I kept right on going until I could get all the way around that lunchroom with that walker. You know, I was there one morning when they made me go to breakfast there, and I was in there, and I looked in front of me, and I had all these elderly people sitting in front of me. And half of them couldn't really even feed themselves. And I'm sitting here looking at them going, where am I at and why am I here? And although I feel sorry for them, they actually gave me the strength to get out of there. And that's when I took a hold of everything and I rolled with it. To get back to riding was another hill to climb. Riding my motorcycle is my physical therapy. That's what makes me feel good because I'm whole. It's all me doing it and nobody else needs to help me do it. I think after going through what I did, to be able to do something on your own for a change is really great. But I was scared of the way the bike was because I had a two-wheeler and then they made it into a four-wheeler because I had 3 wheels on the back and 1 on the front. And then the gears were a shifter, hand shifter on the left side, which they call it a suicide shift. It was great for about a year, but then my hand just couldn't handle the shifting. And I have an amputated finger and a lot of damage to my left hand, so shifting just wasn't a good thing. So I ended up selling that, and I ended up getting a Can-Am Spider, where I can shift with my thumb, and it downshifts automatically. The floorboards were the best. They're the ones that holds my feet. That's what's so aggravating riding that bike was my foot wouldn't stay on the pedals. This one makes me feel whole. I can get on and off of it without even moving. And it's just no shifting. I get off, my hip doesn't hurt me anymore. So this is good. This is good life. My support system was awesome. Not only did I have my family, but I had the Legionnaires, which is Salute 82, a group of guys and women that were right there for me the whole time. They called me, tried to get me doing stuff. Even before I was riding, they were trying to get me to make bracelets, stuff to get my mind back going again. And I don't know how I ever got them in my life, but they have been the most wonderful people I've ever met. I mean, they're there for me all the time. They want me to ride with them every weekend, and when I ride, they put me right in the middle of them. So it's kind of funny. And my nickname is Chicken, because I won't ride in cold weather. The guys are awesome. I don't know if I could say enough about them. In order to get through it and make myself feel good again, I just had to push. I had to put my leg on. I just went out, get on my bike, ride. The phantom pain is something you deal with every single day and every night. I deal with it every day, even with a stimulator implant. But staying busy, physical therapy is awesome for phantom pain and depression. So, and once you can get yourself back in check again, then you just go on. You know, you just have to it's a big fight all the time. But you can do it. I can do it, anybody can do it. My advice to anybody that's lost a limb, any limb, do not give up on what you once did. In other words, get back to doing what you were doing before your amputation. Don't give up. You know, there is life after amputation. And I promise you, there will be a lot of good days, be a lot of bad days, but you can work through it. Get yourself back to where you were. I'm Becky, and this is My Possible.
Hello, everybody, and good morning. Welcome to Discover Your Possible 2020. My name is Cosi Belloso. I'm a physical therapist here in Tampa, Florida. I've been a PT now for a little over 17 years, and I've pretty much worked in every setting imaginable, from ICU, inpatient rehab, home health, and outpatient. We're going to be talking a little bit about some of those experiences. And I've worked with so many different individuals with so many different pathologies, but my passion is working with the amputee and limb loss community. I have a private practice here in Tampa called Palanca PT, and it is exclusively for working with people recovering from limb loss, teaching them how to get ready to use their prosthesis, walk, run, and get back to their lives. So I am also the host of Cosi Talks, if you can see the sign up here. Cosi Talks is a live show I do every Wednesday night on Facebook, where I answer all questions regarding recovery from limb loss. And I love bringing on special guests, experts in the field, and bringing different educational topics. I want to say a special thank you to Mission Gait team. This has been an amazing accomplishment that they were able to bring this virtually, and in doing so, be able to expand on a global level. I just saw the list here this morning of all the different countries we have joining us. Obviously, we've got the United States. We have Portugal, tudo bem, tudo bom. We've got Nigeria, India, Pakistan, the Philippines, como está? We have Canada and Ecuador, buenos días, Ecuador. So I am so excited to be able, as a clinician, to speak to so many different people in so many different countries and different cultures. So guys, if you've watched my show, you know that I love to interact with my audience. So please don't be shy. We do have a little bit of a delay here in terms of the comments, but I'm going to be monitoring these comments, and they're already starting to roll in. We've got Robin. Robin, you are amazing. Thank you so much for bringing me on board with this team, this amazing team. We've got Carol here. Summer, good morning, Summer. We've got Pete Rossi. Good evening. Oh, from India. Oh my goodness. Thank you for joining us this evening. Guys, it's such an honor to be able to speak in front of this audience. I won't lie, when we first got together this year to talk about how this was going to look like, I was disappointed. I was actually disappointed because last year we did so many interactive labs. We talked about the Gait cycle. We talked about muscle strengthening and physiology. We talked about proprioception, and then we did all these great exercises with it. So this year I had big plans to bring in a follow-up to all of that. But obviously COVID had different plans for all of us. Now, the silver lining with this is not only were we able, like I said, to expand to a more global audience for this conference, but I'm going to talk to you about something today that's not quite so tangible, but it's still extremely important in the recovery process from limb loss, and honestly from any trauma imaginable. As some of you may know, on a personal note, I am a mother of 4 beautiful children. I'm a violinist, I'm an athlete, and I'm also a breast cancer survivor. And the reason why I mention this is because even though I cannot relate to many of you in terms of losing an arm or a leg, I do know what it's like to have my life turned upside down from one minute to the next with a health crisis, and to have to undergo a very long recovery process, and then the process afterwards of putting my life back together again and seeing what that looks like. So today's talk is going to focus a little bit more on the mindset of healing from something like limb loss. It's about how do you take it to the next level? How do you address fear? Okay, so here, I'm gonna click back to some of these sections. I don't wanna miss any of these comments, guys, so I'll be clicking back and forth. We've got Tina here, Phyllis, oh my wonderful. We've got Mary here. Comments are flying everywhere. This is wonderful. We've got, oh, Carol, thank you so much. We've got Diana Baker. She says, thanks, good morning, everyone, to bring us together, sharing their story. We've got some folks here from Germany tuning in. Excellent, all right, guys. So as I mentioned earlier, in my years of practice, I've had the good fortune of working with people from ICU, acute care stay, inpatient rehab, home health, and now with my clinic in the outpatient setting. And when I think about all the conversations that I've had with all of my patients over the years in these different stages, there's definitely a common theme that I would have to address with each of these patients in each of these stages. And it was about fear. But ironically enough, it wasn't about fear of failure. It was about fear of success. It was addressing about the fear and the anxiety that's associated with going to the next level of recovery, of realizing that they were ready for that next level and that they were going to embark on a new phase that was unfamiliar and honestly quite scary. So I'm going to talk a little bit about what that looks like in the different phases of recovery, and hopefully we'll have some light bulbs kind of going off. And guys, let me know what you think. If there's anything in this conversation that you feel like, yep, this is definitely something that I can relate to, that I went through, post it up there in the comments section, not just so I can read it, but also so that our fellow viewers can see that they're not alone in some of this process. So I want to take you guys back to your original amputation surgery. For those of you who had multiple revisions, I want you to kind of think back to the most recent one, hopefully your last surgery. Think about those first moments when you regained consciousness, and you probably had some sort of thought like, oh, good, I made it through the surgery. I know I did when I had some of my cancer surgeries. It was the, oh, goody, I made it to the other side. I'm alive. Now what? Okay. For many of you, what came afterwards was probably a few days, quite a few days of painful movement, of learning how to do some of the simplest of tasks again, learning how to sit up in bed, learning how to move the limbs over to the side, learning how to stand and transfer to a bedside chair with a walker. Any of this sound familiar to many of you? Good morning, Connie. Good morning, Destiny. Guys, I like talking to my audience, so you'll see me interrupting myself to go talk to my audience every once in a while. Now, guys, I know when I would work with my patients during this stage, I would always reinforce with them the breakdown of these tasks. So instead of coming in the room with my walker and telling my patient, okay, let's get you up out of the bed and get you into the chair, I would break it down into bite-sized pieces. I would say, put the head of the bed up. Good, you didn't pass out. Now let's start helping you move that limb to the side of the bed very carefully. Now let's have you scoot towards the edge of the bed. And that was a really scary moment. I would slowly and carefully move them through these little stages until they were safely in the bedside chair. And there were many reasons for this. Number one, I didn't want my patients to end up on the floor on their first day of physical therapy. That's really not a great way to start out. And two, I wanted them to see that when they had focused on the immediate task at hand and blocked out everything else in their minds, they could make what seemed like an impossible task, be able to break it down and make it happen. Now, once my patients were in their bedside chairs and more or less settled there, I would purposely ask them, bet you didn't think you were going to be doing all of this today. And it wasn't just to make conversation, guys. It was to get my patients to reflect upon what they had just accomplished. This obstacle that had seemed so scary to them when I told them about it coming into the room was now something that they could check off their list. And if I had the opportunity to work with the same patient through their discharge, I would always try to build upon what I had planted in them on that first day. In a way, I wanted to give them a little bit of my own clinical mindset, the ability to acknowledge that the task in front of them was possibly going to be a doozy, but also to take that task, break it down to its components, and do it piece by piece, step by step. And I wanted them to realize that with the help of a highly qualified rehab team, they could be in charge of their mindset and learn how to tackle and get to those goals. So herein lies the rub, as my husband would say. The real test would come the day of the discharge. The hospitals I used to work at would require for amputee patients to be cleared by the physical therapist before they could go home or before they transferred into inpatient rehab. And this was a responsibility I took very seriously. I knew that my patients had to be absolutely solid and safe with their basic mobility if I was clearing them and sending them home to an environment that would have stairs and steps and children and throw rugs and pets. And I also had to make sure that they had the right amount of strength and endurance behind them to be able to tolerate the 3 hours of therapy that they would be receiving if they were going to inpatient rehab. So you can imagine how surprised I was, and this was back in my early years as a physical therapist, when I would walk into a patient room and I would say, congratulations, you're ready to move on to the next step, you're going home, or you got accepted into the inpatient rehab program, and I would get the complete deer in the headlights look. And here's some of the responses that I would get from my patients. I would get, I'm not ready. I'm not strong enough yet. 3 hours a day of therapy is way too much. My home doesn't have all the modifications for it. What am I going to do with my medications? Now, guys, it's not to say that these concerns weren't valid. These were very real worries. But as I would explain to them, all the reasons that they were kind of giving me had already been addressed. I would say things like, yes, Mrs. Smith, you're ready for rehab. Do you remember how you walked the whole distance of the hallway with the walker? Or, Mr. Smith, don't worry, your home modifications aren't done, but your family's already gotten the downstairs part of your house ready for you while you're waiting for those mods to be completed. Or, Mrs. Smith, don't worry, we've arranged for the home health nurse to meet you at home when you get there to help you get settled in. Now, as I gained more experience, I realized it wasn't necessarily the details that were dragging my patients down. It was the fear of the unknown, of having to manage a new setting with new obstacles. And it was a scary situation that they hadn't encountered yet with their new body. Does anything ring bells here for you? We're going to take a quick poll here. What was the scariest part for you when it came to finally going home for the first time after your amputation? And I'm going to switch over to the comments section because I've seen some comments flying in and I don't want to miss too many of these. Let's see, we've got Melanie saying, oh, thank you so much, Melanie. We've got Destiny and we've got Jennifer saying different, oh, thank you. Love that you're discussing these different recovery phases and goals. Yes. And guys, this is something that as clinicians, we have to learn as we go with the experience. And I know that the way I approach my patients now as an experienced therapist is so much more different than when I first started out as a PT. And I'm recognizing that teaching my patients how to have this mindset is just as important for them for their outcomes as it is to teach about gait, about balance, range of motion, and strength. So Tina says that losing the nurse and ancillary support and being a burden on my social circle was very scary. Pete says, haven't gotten home yet, checked myself into assisted living. Destiny said she was wondering how I would be a mom to my 1-year-old. Destiny, that's something that hits home for me as well. Marcelo is from Brazil. Oi, tudo bem, Marcelo? We've got Phyllis saying, getting home into my home was a major fear. Right, trying to get in through those steps. Maggie says, having to go straight into isolation, knowing that I had to cope alone at home with the right BK revision 2 weeks ago. My goodness, and this guy's, everything I'm saying now, it's not even within the context of what's going on with COVID. Linda says, getting into the car and getting out when I arrived home. Linda, I gotta tell you something, when it comes to teaching all the different aspects of mobility for my patients, teaching patients how to get into and out of a car is still something that will get my own heart rate going. And I've done it hundreds of times. Tina says, having to plan for caring for my own primal needs, food, bathroom, etc. Yep. Haravamsh from, we got our listener from India says it took 2 weeks for me to look normal and answer some questions of my friends and family. Carol says, being in the Army, I learned that where there is a will, there is a way. Even if it meant crawling on all fours, I would get from point A to point B. Hua, Carol. Thank you for your service as well. Jody says, fear equals free each avenue to recovery. I like that, Jody. So guys, let's talk a little bit more. I'm going to switch back to my screens here. I'm so proud I haven't accidentally clicked myself out of this talk on accident. Okay, guys, so that's kind of like the first stage, those first initial stages, which some of you right now are currently going through it. So let's move on to what it looks like afterwards. Later in my career, I worked for several years in the home health setting here in Tampa, in the Tampa area. And while the obstacles and issues were different compared to those I would encounter in the hospital itself, that fear factor was still very much there. And again, my approach was very similar. So for example, when I would first go to a person's home after their discharge from the hospital, I would address the bathroom issue first. And I think there was somebody here who said primal needs, right? How to get food, how to get to the bathroom, okay? And when I would ask my patients if they had been to the bathroom by themselves yet, since they had been home, again, deer in the headlights look, right? A task that once upon a time had been done without thinking now required a full-on game plan to perform. And once again, guys, it came down to teaching my patients how to take one problem at a time, focus on that task in front of them. We could deal with the cranky kids and the family later on, and how to break it down. So in this case, I would literally clear the path for them. I would take out throw rugs, toys, shoes, anything that could possibly be a trip hazard. They would call me the feng shui PT. And inside the bathroom itself, I would take out the little bath rugs, the waste paper basket, anything that could be a trip hazard. I'd have all the doors wide open and ready. And guys, my patients seeing me scuttle around and take these steps, I could see them kind of start to formulate a plan in their own heads as to how they would get into the bathroom. I could see them start to break it down in their minds, and they would realize that they could, in fact, accomplish this feat. Now, it's not to say it would always go smoothly or even well, but always at the end, I would once again have my patients reflect upon what they had been able to do, and to understand that the next time they attempted this activity, they were going to be able to do it with just that much more knowledge, with a more peaceful mindset, and knowing that what they would have to adjust and improve upon, and that with practice, they would continue to improve everything that they tried. So guys, some of you mentioned here what were some of your obstacles when you first went home, but if you have anything else you want to add to that, please do that right now. So I know Destiny mentioned about how to maneuver with being a mom to a 1-year-old. Jody says she would take the doors off, and getting off the toilet is scary. It is. And you know, as a home health therapist, a lot of it was just problem solving and getting people to be comfortable within their own homes and making that a safe environment that they could feel comfortable moving in. So let's see, let me click back to the other screen. Sorry guys, I'm like clicking back and forth here. So once my patients could get to the bathroom safely, check. They could do basic activities at their kitchen sink, check. They could get to and from the bathroom and bedroom and watch TV, maybe even get to the mailbox for some fresh air. Things were beginning to progress with their strength and range of motion. The wound was starting to look better. The residual limb was starting to feel better. And then comes the next big step that I would throw at my patients, going to church. Now, the reason I use church as an example is because here in Florida, I don't know about other states, in order to be declared homebound and to receive home health services, the only places you're allowed to go to are your doctor's appointments and to church. So if my patient was someone who had previously attended church, I would really try to get them back there. Not to mention, if you're Catholic like me, all that standing up and kneeling down does amazing things for your glute muscles and strength there. But anyways, once again, The fear of the unknown, guys. It was the fear of taking it to that next level, the fear of exploring outside the safety of their home that would paralyze my patients. All they could see was the enormity of how to get to the church pew, that final goal. And once again, it was about getting them to focus on one thing, that one task in front of them, and build from there. So in this example, guys, I would start with teaching them and their caregivers how to get themselves into and out of a car safely in their own driveway. And I believe there was somebody who made that comment that getting into and out of a car was a very scary thing. And it is, it's a very scary thing. But fortunately, it was something that we could practice right there in their home environment as often as we needed to until they felt comfortable. And then I would often have the caregiver or a family member go and take a look at the parking situation at the church. What did the handicap parking spot look like? Where was it located in relation to the nearest entrance to the church? Were there any benches along the way where people could sit down and take a break while they were getting into the church? Could maybe one of the ushers put a chair at the entrance with armrests so that they could minimize the amount of distance that they would have to be walking? Guys, I would literally plan a route step by step with my patient and their caregiver. And I would even suggest that they arrive 15 minutes early to avoid the rush into and out of the building. The nice thing is with church, once they got there, all they had to do was just kind of sit down and rest. But what a sense of accomplishment, guys, when my patients would take that big leap of faith, bad pun, sorry guys, and actually get themselves to that location. So quick poll, another one of my quick crazy cozy polls. What was the first place that you all went to that was like your first big outing outside of your house and into your community? What was that place and how did you tackle this? I'm gonna go see what these comments are. Let's see, right now I can imagine going home, says Pete. Robin she had obstacles of 2 big Labrador retrievers with wagging tails. Let me tell you, those wagging tails can pack a punch when you're trying to walk around your home. Summer says, church is the best place to go to give all your problems and fears to the man upstairs. Amen to that. We've got Bruce saying, how long would you say it takes to go post-op to going to church? Bruce, a lot of that was just also dependent upon the surgeon. If the surgeon I would always check with my patient's surgeons first and just say, okay, are they clear from a medical standpoint to be out in the community? Do they have any issues? Obviously now with COVID, things look very differently. But prior to COVID, do they have any issues with their immune system that would prevent them from going out? And then once they were cleared from the medical standpoint, Bruce, what I would do is it's a mobility. I would make sure and I would drill my patients to make sure that they were safe getting into and out of the car, practice walking the distance, working a lot with the family and the caregiver to make sure that they were safe. All right, Keith says the mall, that was the big area. Carol says the big VA hospital. Let's see, the other Carol says going to my daughter's home and going up her stairs. Haravansh says my college with my friends in a car. I waved some people after 1 month of being bedridden. Jean says, no one helped, boy, these comments are wonderful. No one helped me go to the bathroom. I was taught to stand up using the rail of my hospital bed and someone taking away my wheelchair, putting a commode behind me to take care of business. Linda said, going to the restaurant, had family and friends with me. Susan went to work and cried, completely overwhelming seeing everyone. Isn't it amazing? And then Robin said she left the hospital and went immediately to her son's football practice. Maggie says, the laundry room downstairs is my apartment block. Opening my front door to go to the lift had me crying with fear, but I did it anyways. And guys, these comments are going so quickly. I hope all of you are able to see this. It's amazing how just even the smallest of tasks can be such an accomplishment, guys. For me personally, after I had 4 major surgeries related to my cancer. And after the first one, it was getting to go see my daughters at their spelling bee. And this was maybe 10 days after my first major surgery. They were in the school-wide spelling bee. And I knew that all I had to do was get from the parking lot to the chair that somebody had set out for me in my kids' school gym to hear them in their spelling bee. And that was, that was huge for me, huge. I went from running 5 miles a day to just being able to get from point A to point B and sit down in a chair and listen to my kids participate in their spelling bee. And I felt like I had accomplished the world with that. All right, guys, let's move on, because I think at some point someone's going to have a hook and pull me off the screen because I'm running out of time. No. So let's go on to that final phase, and it's outpatient. It's currently the phase that I am in right now. And to me, I kind of consider it to be the final frontier. You can tell I'm a Star Trek fan, right? It's the phase where many of you will be finishing your traditional rehab. And after that, it's the great big scary world that you are released into. Now, in my current practice setting, I have one patient right now that I feel like she's kind of my poster child right now for trying to establish this mindset that I want to give you today. I've been working with her for some time, and we've made a lot of improvements on her strength and her balance. She finally got in with the right prosthetist and has a beautifully fitting socket. All the pieces from a physical standpoint have been coming together. And she is ready now to go out into the community without a cane. And for those of you who know me, you know I am a real stickler about making sure that my patients are more than adequately prepared to do something like this. I want to make sure that they are absolutely safe before I turn them loose in the community without a walker or a cane. But right now, what I'm working with this particular patient, it's not just about the progress with her strength and balance. It's with fear of letting that cane go. It's with getting this extremely active individual to go to the grocery store by herself, to take that trip to the mall with her granddaughter, to go on a plane and visit her family out of town once things with COVID calm down, hopefully calm down a little bit. And I won't lie, this is a struggle for me as a clinician as well, because I know that I can only take her so far. I've already given her all the tools that she needs to physically be able to do this safely. Now she needs to take that next big giant leap. I can only lead her to it. She has to be the one to rip off that Band-Aid and take that next step. So guys, for those of you who have been able to receive physical therapy in an outpatient setting, what are some of the activities that your physical therapist is pushing you to do? Because I know I'm not the only one. And if I have any clinicians listening in right now, I want to hear from you as well. What are some of the higher end activities that you try to get your patients to do to push them out of their comfort zone? I know I'm missing some of the comments here. Let's see what's going on. Tina says her first minor outing was walking in the neighborhood with her home PT, and then with family and friends using a knee scooter and then crutches. First major outing, a 5K on side sticks crutches, and had a big group of friends to join and follow with a wheelchair. That is awesome, Tina. Fionn says, thank you so much. It's really insightful to what it's be like in the clinical mindset when treating and helping amputee patients. Absolutely. And Fionn, even as a clinician, if we can give our patients a little piece of this clinical mindset to help them kind of step back sometimes and try to give them those same objective lenses that we have, it can kind of help them learn to tackle. Because let's face it, guys, these obstacles are going to be present throughout the rest of your life. The healing process, as I'm personally finding out myself, the healing process is a lifelong process, okay? Let's see, Jean says it's been 1.5 years since my amputation. I still go to the bathroom that same way. No OT or PT has helped me move past that. COVID made the situation worse this year. So Jean, we're gonna talk a little bit about this in a minute on what's next. What's next? Harabamp says, walk, walk, and walk, yes. Jody says, I'm moving across the country and I was scared to get up in the big U-Haul truck. So I went to practice yesterday and I got up and down with no problem. Jody, that is a perfect example of what I'm trying to bring across today. You know, instead of saying, oh dear heavens, how am I going to move across the country? It's saying, okay, the first step is learning how to get into that U-Haul truck. So let's just focus on that one step. Beautifully done, Jody. So Melanie says, as a PT, getting people comfortable with falling and getting back up without injury. And Melanie, I tell you what, you hit the nail on the head with that one, because whenever I am working with my patients and I say, well, why don't you try going to the grocery store? You have your husband standing next to you, just get from the handicap parking spot to the entrance of the store. And inevitably it's a fear of falling. So it's saying, okay, let's address that fear. Let's practice that one component that is holding you back. so that you know in the worst case scenario, if you lose your balance, you know how to get yourself back up safely. Okay, excellent point. Tina says some good exercises, proprioception work with lacrosse ball and a prosthetic sneaker, partial weight bearing, really helped me to learn where my leg and foot was in space without watching my feet. Look at Tina, she's using proprioception. I like that. Destiny says being able to walk with my daughter into preschool, depending on COVID, without a cane. And Destiny, I drop off 4 kids every day at their school, and it's a minefield trying to get through that parking lot and having to go up and down curves, uneven parking lot, not to mention kids with their backpacks swinging around. You got your groups of moms talking here that you have to go in and out of. It's an obstacle course. It really is an obstacle course. Linda says, putting weight on my prosthetic and lifting my opposite leg for 10 seconds and now trying not to hold on. Very good. All right, let me go back here. All right, guys. So I just want to kind of wrap things up. Now, for some of you listening, I know I have some rock stars out there. Some of these issues that I mentioned specifically today weren't necessarily ones that you had to go through. Excuse me one second. I have a cranky cat. Some of you may have been the rock stars that came from the hospital and immediately started going out into the community and participating in the community. But at some point, each one of you has or will run into some sort of roadblock, whether it's an activity that you used to do before amputation that now you have to try for the first time using a prosthetic leg, or maybe without a prosthesis, or maybe it's taking that first trip out of town to go see those family members that you haven't seen in a really long time. At some point, there is something there that you want to be able to do. And if all I can do today is to get you to examine what that is, what is it that you want to do to improve that quality of life, then I'll have earned my supper. And I would encourage you, take that one thing and just really take a good look at it. Jody's got the perfect example of what she just said right there. You know, she's moving to a completely different state and city. And instead of looking at that task as a whole and looking at, where you are in the beginning and where you need to be at the end point, look just to see what's that next step that you need to take to get there. For some of you, it's acknowledging that, yes, in order to be able to do what you want to do, you need to improve your strength and balance, and you need to finally make that appointment with the physical therapist, which, believe me, guys, I appreciate just how much guts it takes to do that, to make that commitment, not only as a time, but just that mindset of saying, I'm going to do this. Okay, so I want to hear some more thoughts on what are some of the things that you all, just pick one task, one thing that you all want to be able to do that you have not been able to do. Let's see some of the posts here about that. Will, how am I doing on time? I'm good. Okay, awesome. I see so many comments coming through here. Let's see. Jen says that Jennifer says, as a prosthetist, am I to expect a PT or OT to help with amputees to use the bathroom? Typically, I think that is taught an inpatient. I will try to assist to get therapy for amputees while I'm treating. The answer to that, Jennifer, is yes, absolutely yes, and oh my goodness, yes. In every setting, Jennifer, the physical therapist and the occupational therapist especially, we are meant to be assessing the different aspects of activities of daily living, ADLs. So like I said, I've worked in every single setting of physical therapy, and in every single setting, when I'm doing that initial history and physical on my patients, I ask them that specific question. How are you getting to the bathroom? How are you getting in the shower? Do you have any difficulty with this? Because it could very well be that it's never been addressed before. They could have made it to outpatient and they're still having to use a walker to get into the bathroom when maybe they're capable of doing it without a walker or without necessarily the elevated toilet commode. So yes, Jennifer, this is definitely the time to talk to your PT and OT because they can really help your patients out in this regard. Let's see, Carol says, with car headlights, you only see 10 feet in front of you. There you go. Phyllis says, with swimming. So Phyllis, this is a great one. And also because I'm here in Florida, people want to go to the beach and they want to go to the pool. So in taking swimming, a couple of different steps you need to look at. Take a look at the prosthesis that you have on. Is it something that is allowed to get wet? So you need to determine, am I going to go swimming and get into the pool with my prosthesis? or without my prosthesis? And this is something, a conversation you need to have with your prosthetist. Your assistive devices. What assistive device do you need to get yourself across a pool deck that potentially will be wet and get you safely to the edge of the pool? I know many of my patients for this stage, they like to use either a walker or crutches, depending on their level of balance, okay? Once you get to the edge of the pool, and again, this is something you might want to check out before you even try swimming. Just go take a visit to the pool and just see what the setup is. Do they have the chair that lowers into the pool that you can learn how to use with the lifeguards? Do they have a walk-in, a graded walk-in section, or do they have stairs to get into the pool with a railing? And you need to plan, okay, how am I going to get into the pool? How am I going to get out of the pool? And once I'm out of the pool, how do I get back and up into standing? So when you break it down into these tiny little steps and just take one step at a time, learn how to problem solve it, you can put it together. And again, Phyllis, it's not going to go perfectly the first time around. You might need to try it a couple of different times. All right, guys, we've got a couple more minutes, so I want to see if I can get to any of these questions. Susan says, stand and then walk, leading to a 5K. And guys, lately I've been seeing a lot of runners in my clinic and a lot of people who like to do races, and I love this. I love this. This is like the very definition of PT goals right here, of seeing a long-term goal and breaking it down into its little steps. And I know, Susan, you have an amazing rehab team who's behind you, taking you through each one of these little steps. Carol says, getting in and out of the sand on the golf course and not falling. This is another big one, especially in Florida as well. With the golf course, as Carol knows, you have a lot of inclines and ramps as you have to go up and down the golf course. The sand, that is a tricky one. That is a tricky one. And again, this is where you play around depending on what kind of a prosthesis you're wearing and depending on your level of mobility. But practicing on a ramp, for example, going up and down a ramp, putting yourself into a sandy area, maybe even trying it out on a playground and learning how to do some sidestepping, forward and backwards walking on sand, so that eventually when you go to that golf course, you can tackle it there. Or even, Carol, just something as simple as saying, today, I'm just going to go for 10 minutes to the golf course, to that one sandy spot, and just practice walking in that one sandy area. It could be just as simple as that, guys, just taking that one small step. Trey says, Carol Baker, keep it in the fairway. Go. Let's see what else we got here. Maggie H says, I want, need, and will get back to a triathlon. Lots of individual skills, steps, and equipments needed bit by bit. And Maggie, I do want to point out, and this is something I point out to a lot of my higher end athletes, even in there, when I ask them, I tell them, think about what your life was like before amputation and when you were running and doing these triathlons. There were so many small steps that you had to take in order to be successful with this triathlon. There was so much training you had to do. Now, you're going to be taking just as many steps and just as many preparation items, but it's just going to be in a different way. But you're still going to be able to get to that goal following these things step by step. Linda says, I can now ride my horse and recently rode an adult tricycle. It was so scary at first. Ended up pedaling 3 miles. Oh my goodness. That's a long way to go, Linda. And guys, I'm excited because today you're going to have something, an organization, Sportable Organization. And they are one of these amazing opportunities where you can get to try some of these new skills that maybe some of you have been a little hesitant to do. So if there's anything today I can recommend to you to do is rip off that Band-Aid and go see what you can do for that new skill. All right, Denise says it's been 2 years, had lots of lower back pain and hip pain on the amputee side, getting pain under control with a chiropractor and home exercises. And Denise, if I can recommend to you as well, along with the chiropractor and home exercises, go see a physical therapist. The nice thing is even though there's not a whole lot of amputee PTs out there, there's a ton of physical therapists who specialize in back pain, and they can be such a valuable tool for you. So maybe that's just that extra step, just to get evaluated by that back pain specialist physical therapist who can maybe bring a different piece into that puzzle for you. All right, guys, how are we doing, Will? We're good. I got to give a shout out to the tech team behind the scenes, man. This is like the Wizard of Oz behind there. They are running this technology so smoothly. And any of you guys who know me personally know that technology is not my strong point. So the fact that this has gone so smoothly is a direct credit to the team. We've got Holly, Tracy, and Will behind the scenes. And I just want to wrap up by saying thank you so much to the Mission Gait team for bringing me on board today again. It has been an honor to be a part of this team and to speak at this conference. To those of you attending, as I say on my show, thank you so much for letting me be a part of your lives this morning. And hopefully I will be seeing some of you again in the breakout sessions this afternoon. Highly, highly encourage you, whether you're a clinician, a caregiver, an amputee, join these breakout sessions. There's so much that can be, I think, accidentally learned when you talk just to a new group of people. All right, guys, I think with that, I am going to go ahead and sign off, and I'm going to actually be an audience member, and I can't wait to see all these amazing videos that this team has put together. And as a small plug, hopefully you guys can join me this evening, Cosi Talks on Facebook, and my website is super easy, www.cositalks.com. I know, really original, right, guys? All right, guys, enjoy your day, and really just take that one thing, grab the bull by the horns, take that one thing that you want to be able to do and start breaking it down and making it happen for yourself. All right, guys, have a wonderful rest of your day with this amazing conference, and we'll see you later. God bless. Bye.
My name is Carter Lewis. I work for Hanover Fire EMS. I'm a firefighter here. First day into the field after academy. That night ran a call on 295 in the middle of a tropical storm. We were parked inside the interstate and track trailer hit us, causing some injuries to my lower right leg. So we went to the hospital and just my foot was crushed, but it was a crushed point where they couldn't repair it, so it was a better option to amputate below the knee. So I woke up the next morning, they amputated. I had a couple surgeries just to reclose my stump. Then also my knee was really damaged, so all the ligaments in my knee were cadavered out and replaced. So I lost a lot of mobility in my knee because of that. I think I was in the hospital about 3 weeks, and I came home for 2 weeks and had to go back to have some infection taken out, my stump. And then sort of just did in-home therapy for a while, just lady coming once every other week or so. And then I went to full-time therapy, I think in December. So the accident took place in October, so I waited a couple months just to heal a little bit. It's just always what I wanted to do. I've had a lot of friends in the fire department. I've been volunteering since I was about 16. So it's just something I've been doing for a couple of years already before, and finally got hired and got paid to do it. Didn't want to give it up. Worked a lot on like getting my muscles to grow back using like electric stimulation. Just because I hadn't been on my leg for so long, my quads and everything had shrunk. You couldn't even tell. The leg is probably like half the size of my other one. So we worked on that. Worked on a lot of like trying to get mobility in my knee because my knee wouldn't bend all the way, and it still hasn't come back, and it probably just never will. And then worked on just getting used to prosthetic, like slowly walking, working my way up to running. So I had to work on like getting my strength up because we have to carry like heavy objects, obviously, whether hose, people, whatever it is. So definitely working on that, stability, being able to like stand up while I'm taking pressure from my hose line and throwing ladders, and just being able to basically get back to where I was before. Just being stable enough was one of the biggest things, and also being able to move fast with a lot of weight. When I came back, just got to get right back into it. Just basically trying to start over again, day one rookie. So still like a little bit of soreness, obviously, just from walking, but I've been sore since it began. It's gone away at this point. It's been almost 2 years now, so not sore at all. And then just got to hang out with the guys and train every day and enjoy what I do. So I wasn't nervous about coming back to work. It really just felt good to be back in the firehouse. And I wouldn't have come back if I didn't feel like I was ready. Just because I didn't want to put the guys in danger of me going down. I didn't feel like there was any threat of that. So I felt 100% comfortable. The department didn't have to modify anything. The only thing we had to modify was because it takes so long to get like a shoe off your prosthetic. So most guys, when they get dressed, they have a pair of structural pants wrapped around their structural boots. And the first thing you do is take off the station boots and just step into the boots, pull the pants up, throw on their coat and their Nomex hood. For me, the only thing that's different is I just throw my left boot off, and then I throw off my prosthetic leg, step into my left structural boot, and then I step into a prosthetic leg that's already in my structural boot. And then everything else is the same. So that helped improve the process. It's quicker than most of the guys with 2 legs, so it's still fine. During the call, I usually always forget about it almost, like I don't pay attention to it. The only downfall I found is like after a while, obviously sweating and using sock management. So if I'm on a really long call, I'll start to get a little bit sore just because it's shrinking down in there. And when you're on a call, you don't have time to change your socks, you just got to deal with it. And then the only other problem, especially during the summertime, is just the sweat. So like after a call, I'll take my liner out and just dump a bunch of water out. It's real nice. So. Obviously, it was hard getting back. It took a couple months, almost a year, to get back to where I originally was, but it hasn't really stopped me from doing what I do now. So an avid hunter, fisherman, get out and do all that all the time, and so a pretty tough, physically demanding job, and do pretty well. Piece of advice I give is just don't get down on yourself. Don't feel miserable because it's not going to help anything. It's going to hurt. It's going to suck, but just give it time and you can get by. Get through it.
Carter Lewis, this is my boss.
My name is Tracy, and I'm a physical therapist who works with lower limb amputees. One of the biggest differences when you work with amputees is you just really have to step outside your physical therapy comfort zone. The componentry, the sockets, the prosthetic device, all of that really isn't taught in physical therapy school. And so you kind of have to learn that on the job. And so you are talking with the prosthetist and constantly collaborating and asking questions and learning so that you can kind of provide that knowledge to your patients that you don't immediately get out of school. So I think that's just been the hardest part, is trying to keep up with the changes that are going on in that field, and finding my team that I can use to kind of keep me informed of what's changing and what I need to know for my patients to do their best. I think the hardest part of working with amputees is just that I will never understand what they're going through. I can't understand. I've never lost a limb. I've never had to learn to walk again. And so to kind of gain that trust of a patient when you can't understand what they're going through takes a lot of time. It takes a lot of patience. It takes a lot of listening, a lot of empathy to build that kind of relationship and that trust between them. will say that we can't understand what they're going through, but that we've listened and asked enough questions of those who do understand that hopefully we can help them. There are many great things to working with the amputee population, but I think the best is just the people that are amputees are resilient. They are tough cookies, and they inspire me every day at work. I mean, when I get to be a part of their journey, learning how to walk with confidence and independence, to do something that I once took for granted, like going into the grocery store, going to the back, grabbing a gallon of milk, walking back out of the store and saying, I didn't think about that. When my patient comes in and tells me that story, I'm completely inspired, and like to be able to do that every day with patients is definitely the best part. I think the role of a physical therapist with the amputee population is definitely part coach, part cheerleader, and part teammate. You're the coach, you're teaching them, you're helping them learn how to do something brand new, which is walk on a prosthetic leg. And you are the one guiding them on the ups and the downs of what it feels like and how to move confidently and independently so they don't hurt themselves down the road. They don't develop compensations that could lead to pain later on in life. You're their cheerleader on their good days and their bad days. They're gonna come to you on those days that are really hard, and I think the therapist is there to kind of push them to that next level and through those bad days. And then most, I think importantly, you're their teammate. Like, you are there with them more than anybody else during this process, and you're the one who can help them collaborate with other experts in the field. You're the one that can connect them with other amputees that they can share experiences with. And you're really just kind of, from the get-go, their teammate. My advice for students and clinicians working with amputees would be to keep asking questions and keep listening. Ask the questions and listen to your patients, because you don't know what question you've asked one patient, that answer may help a patient down the line. Ask questions and listen to your prosthetists. Listen and ask questions of the expert therapists, and find those resources out there that are available to kind of help you gain the knowledge to be an awesome clinician for this population. I'm Tracy, and my job is to help you discover your possible.
All right. Hi, everybody. My name is Carolyn. I'm going to be with you for the next 15 minutes for the dance segment, and I have Tracy here helping me out. We hope that you enjoy this part of Discover Your Possible. I'm really excited to share with you. We're going to do a warm-up to get you all loose and stretched out. Then I'm going to break down some dance steps. Now, typically we would spend a little more time, a little more detail, and I'd be able to talk with each one of you. So just know this is slightly different. Modify anything I am telling you to make sure that you remain safe in your home. If you need to do this standing with a chair to hold on to or a countertop, that is totally fine. And as you can see, Tracy's going to be doing a modified version of what I am teaching. After we go through some of those dance steps, then we are going to put it all together in a routine, and it's going to be fun. I'll tell you more about that in a little bit, but let's get started with the warm-up. So you're going to want your feet shoulder width apart. Get a good stable base. We're going to warm up from the waist up, beginning with the head. And you're going to want to look down and up. Down and up, side to side. And side. Again, now get ready to tick-tock, bringing your ear to your shoulder. and 2 more of those. Now we want to bring the head forward and back. I know this looks fun. And now we're going to go side to side. And 2 more of those. Now shoulders, bring them up and down. Shoulders up and down. Roll those shoulders forward and back. And forward and back. Now working just one shoulder, take it back. 2 more. And reverse and roll it forward. And we're doing 2 more of those. And switching sides, roll it back. 1 more, roll it forward. And now we're going to take the arm straight up, bring the hand down, push out with the flexed hand to flat, up, pull it down, press it out, and flatten the hand. Other side, up, back, stretch it out slowly, straight up, back, and all the way out, back to the other arm a little bit faster for 4. Now we're going to switch the other side, faster. Can we alternate these? There we go, you got it. Now we're going to work the rib cage, side to side. Make sure you're keeping your legs and your hips completely still. All right, now we're going to go front and back, and front, back. All right, we are going to get ready to make a box. So we're going forward, to the side, to the back, and side. Now front, let's go the other direction, and back, and side, and back to the front. Now we're going to start to just wiggle those hips a little bit, loosen things up, and make a big circle around. All right, I know that's feeling good. Now let's stretch over to the side, and forward, and side, and just go as far as you can. Other direction, side, and forward, and side, and back up. And now just start shifting the weight on your feet. Just getting a good feel. You can start picking up those feet, even tapping. And swaying. This will get our legs ready for what's coming up next. And let's do a big stretch in and open up and just slightly look up to the sky. And we're scooping in like we're holding a big beach ball and opening up. Good job. All right, let's take a breakdown of some of the dance steps. So first, let me tell you, we are going to be dancing to ABBA's Dancing Queen. So if you're familiar with the song, it's got a little piano accent. And at certain times when I yell out piano, we're going to hit side, front, side. So ladies, you can do the little wrist action. Guys, you can just shoot your arms out if you'd prefer, but that's what's going to be called the piano. The next step I'm calling the finger point, and we're going to be doing some of the little hip wiggle with it. You're going to bring your arm around, clap, clap, arm around, clap, clap. Then we're going to do something that's going to look familiar. Arm up to the back and push out, up, back, push out, other arm again, and then we're going down, center, up. So again, that finger point is just coming around and clapping, coming around and clapping, and the arm, we're doing 3 of these because then we're going to accent down, middle, up. Next, I'm going to show you the merengue. It's a simple step together, step together. You can do it going back and forth. You can do it going in one direction and then back to the other direction, and you can even do it in a circle. So the arms for that can be on your hips. They can be here so that if you're going that direction, you've got that arm out. When you're coming back, we're going to put the arms out that way. When we do the circle or standing in place, you can switch them back and forth. The other thing with the merengue, you can concentrate just on your feet, add the arms. The other thing that you can add would be your hip. As you step out, the opposite hip is going to go up and out. So that's just showing you that action. So it's out, out, out. And the other way, if you want to add your rib cage, which we worked on, that's going to go the same direction as the leg. So that goes out one direction, the hip goes the other way. So the rib cage and the leg go the same direction. And that just adds a little more movement to that step. And again, you can do it in a circle like this. Tip for doing it in a circle. You're going to want to spot where you're going. So you're going to want to look to the wall that you're turning to. So look there and turn your body to it. Look to the next wall to the back and turn your body there and keep doing that. By doing that, you're spotting and keeping track of where you want your body to end up and something to focus on. So the next one we're going to go through is a grapevine. I know I have seen some of you here in the clinic doing this with physical therapists. So that is stepping out and back and out and front, because we don't have as much room, since many of you are at home in your living rooms or kitchens or bedrooms. We're not going to keep going front and back. So this step is going to go side, back, side, together. Side, back, side, together. The arms for that can be on your hips. They can be holding onto something, or you can push your arms down and clap. Push the arms down and clap. All right, let me just double check if there was anything else that I needed to show you. Yes, the most important part, the big chorus. So when we get to where they're singing Dancing Queen, we're going to take 2 walks forward and step, 2 walks forward or backwards and step. So the arms for that are going to pulse and clap, clap. So it'll be walk, clap, clap, and walk back, clap, clap. We're going to step out and throw the arms down diagonally, throw them up, and then get ready for piano. Piano, piano, piano. Then we're going to walk again, pulsing up and pulsing back, throw them down, throw them up, and then they talk about a tambourine, so we're going to do little tambourine arms. Now I think we are ready to do this with the music. All right, get set. Okay, we're just going to start with a little sway. Get ready for the piano. And we're going to start with that finger point move. Here we go. Arm up and out. One more. Ooh, ooh, ooh. Merengue. And we're going to go back the other direction. And here you can stay in place or you can go in a circle. And grapevine, side, back, side, together, side, back, side, together. Do a little shoulder movement. Okay, get ready for the grapevine. And we're going to do the shoulder movement. And let's add a little accent. All right, you got this. Shoulders. Get ready to grapevine again. And 2 shoulders and a little accent. And just rock it out. Get ready for Dancing Queen. And back. And diagonal down and up. Piano. Again, walk it up. And back. Throw it down and up and around. Here we go, finger point. Arm up and out. merengue. And back the other way. And again, you can go in a circle if you want. We're going to get ready with the grapevine. And side, back, side, together. Shoulders. Okay, again. And 2 shoulders. And hip, hip, hip. And rock and get ready for Dancing Queen. Here we go, and forward, and back. Throw it down, and up, piano. And forward, and back, and down, and up, and tambourine around. Finger point. Arm up and out. Merengue. Back the other way. And here we can go in a circle. Can even add your little shimmy move. Let's bring it back up to a sway. Get ready for the piano. Woo! You did it. Great job. Thank you all so much. Bye. Hey everyone, thank you so much for joining in the dance class. If you enjoyed what happened here and you want to view it a few more times to get some of those dance steps and enjoy dancing with us again, this video is going to be coming soon to our YouTube channel. So you'll just need to go to youtube.com/missiongait. Thank you.
I'm David Hamill. I'm a below-knee amputee, bilateral. I am a father, grandfather, real estate broker, and I just enjoy getting outside. I enjoy doing things and trying to get on with my life. The first amputation was direct result of complications with diabetes. I had basically been undiagnosed, but when the diagnosis came, it all came really quick, and so that was quite a blow. I had not expected that, but quite honestly, I was not very healthy at the time, and I was a long way from where I am now. So that was in 2018, May of 2018, and my surgeon, great guy, told me, he said, "Well, we're going to have to take your leg, but I'll have you walking in 6 weeks." And I thought, yeah, right, okay. But we did it, and it worked okay, and I was doing fairly well. And then the same situation happened with the second leg, and that was quite a blow. It is hard to stay positive when you are about to lose the second leg, but as luck would have it, I suppose, I had experience with the first one, and so the second one was not going completely into darkness and not understanding. And so, quite honestly, based on my health at the time, it was the smartest thing I could have done was to lose both of them and then work on on my new normal going forward. Well, there are a lot of challenges, trying to get your life back to where you think it was before. I won't be blowing smoke at anybody and saying that it's all going to be perfect and that your life is ever going to be exactly like it was before, because it's really not. But it is what you make it, and that's kind of a cliche, but you can only do what you can do, and quite honestly, you don't know what that is until you do it. And so for me, the challenge is obviously are probably the same as everybody. I mean, balance and walking. And, you know, I remember after the first amputation, a therapist told me, today we're going to walk without your cane. And I said, what? You don't expect me to walk without a cane, do you? And that was just with the first one. And I looped the table twice and I thought, yay, you know, I just won a marathon. So it's little things that get you back to where you're going to be. One of the things that I wanted to get back to was woodworking. And I'm really not a great carpenter, but I've always liked working with my hands. I've always liked to build things. And my shed was up on the hill. It had been up there for years. It was where I stored the lawnmower, and I always walked up the hill. My backyard slopes up. And so it was up there. But it became really difficult for me to walk up that hill, you know, with these legs. And so we had the shed moved down to the flat area near the driveway. And I had electricity put in the shed. I built a workbench that's in the shed. And it was kind of ironic. I moved the shed and the gentleman leveled it up. He did a great job, but the floor was too high for me to step into it. So the first thing I had to do was build a step. So the very first thing I built with my new workshop was a step to get in the workshop. I also built a handle that I mounted next to the door inside so I can just kind of pull myself up and down. But it's the little things that really that kind of get you sometimes. But like I said, the first thing, build a step so I can get in. Yeah, if I had one piece of advice for someone who is, you know, newly amputated, lost a leg, the main thing really is trust. And it's not what you might think. You need to trust your doctors that they're doing what's right for you. You need to trust your prosthetist that they are going to give you a good device. They will. And you need to trust the device itself. But most important, you really need to trust your therapist when you get into physical therapy, because if you can trust how you got here and the people that are helping you, the team of people that are working on your behalf, if you can trust them, then you can learn to trust yourself and you can take that step. People ask me sometimes, what's it like to walk on these? And I said, have you ever seen anybody on a tightrope? That's what it feels like every day. You're on a tightrope, but you know what? People walk across the Grand Canyon on a tightrope, so why can't I walk across the parking lot on a tightrope? So it really boils down to this. It's just trust. Trust your team and trust yourself, and then take that extra step.
I'm David, and this is my possible.
At Hanger Clinic, our experts will be by your side every step of the way, with the very best prosthetic care and a deep commitment to helping you reach your goals, no matter what it takes or how far away they seem. For more than 150 years, we've been keeping our promises to our patients: compassion, expertise, and a personal investment in your success. What could you achieve if you had no limits? Let's find out together.
All my life, people tried to tell me what I could and could not do. They set limits for me. That's just background noise. I refuse to fail. I'm gonna be the best. Hanger Clinic has been really supportive in helping me achieve my goals. They help me push harder and farther than I could reach on my own. I'm gonna win no matter what, and nothing's gonna get in the way of that.
At Hanger Clinic, we're inspired every day by our patients. Their ambition, their determination, their refusal to settle for anything but the very best. Our patients are the reason we've led the way in prosthetic care and support for more than 150 years and counting. Because big dreams push us all to go the extra mile. What could you achieve if you had no limits? Let's find out together.
My name is Destiny. I'm a mom and I'm a nursing student. I became an amputee May 16th, 2018. I was in a car accident, me and my daughter. I was coming home, my car stalled. I got out the car. I had my flashers and everything on. Got hit by a car. When I got up, I was in the hospital. When I got up in the hospital, I was told that they had to amputate my left leg. Due to the circulation, there was no circulation in my foot and my knee, so they had to amputate it. At that moment, I knew my life had changed, but I wasn't going to let it define me. I never really stopped to wonder why it happened to me. I just knew that this was something I had to get through. I started PT in November. I started coming in my wheelchair first. The first thing we did was worked on like leg strengthening and things like that, and she showed me exercises that we can do at home. I started doing different exercises and stuff at home just to regain the strength of my leg. We started during that time I was coming to therapy twice a week. I would come in twice a week and just really work on starting to regain how to walk. Learn how to walk. That was difficult because I didn't really want to do it. I didn't think I could do it, but my wonderful PT kept pushing me to tell me that it was nothing that I couldn't do. I think I practiced getting on and off the ground at least 100 times. Yeah, because that was my biggest fear. My biggest fear was not if I fell, how was I going to be able to get up? And I expressed that to my PT, and they made sure that that was not a fear of mine anymore. We worked day in and day out of getting in and getting off the floor. We would get on the floor every day, constantly, get up in all different types of aspects. I think I made new friends on the floor. With Malia, being a mom was, she was one, so I didn't know how. I was a new mom, so I didn't know how I was going to be a mom, period. But now having to be a mom as an amputee was a lot difficult of having to make her realize that I just couldn't jump up and get stuff for her, or I couldn't go out and go to the park like we used to do, or I couldn't pick her up and walk off like I used to. Knowing that my limitations were different was the most hardest thing I had to figure out. Once I learned that, just teaching her how to be more helpful to me and the things that we could do together. Showing her that, that it's okay that we can't go to the park, but we can do better things at home. It's okay that, for myself, just learning that it's okay that that I wasn't going to be that active mom anymore. I was going to have to be an active mom in different ways. That process was different. Learning that I was gonna be able to be funner with Malia on a walker versus in a wheelchair. So I knew that I had to get out of a wheelchair to move on to a walker so that I can be able to at least walk with her and go different places that I wasn't able to go in a wheelchair. And then moving on to a cane, I wanted to be able to hold her hand and walk places with her, teach her how to go across the street. Couldn't do that in a wheelchair. Well, I could, but it wasn't as easy as it would be with me and her walking across. So learning how to, it's like how do we learn. It was like we was learning things together. It was like we were learning how to maneuver the streets together. It was learning how we was going to go into different stores and how we're going to have to use the restroom together. just learn how to be a mom in a different form. So. My goal is to just walk Malia into preschool, to be able to be an active mom, to be able to go on school trips, to be able to walk in the grocery store hand in hand, to be able to have that cool robot leg, to show her friends, to just teach her that nothing is impossible, that she can do everything. My goal is just to really truthfully just show her that it's nothing that she can't do. Even if the world gets funky, you can do everything. The advice I would give is to never give up. Things get tough. Things may not seem like it's going to be easy, but it is light at the end of that tunnel. Keep moving. Keep looking straight ahead. Nothing is wrong with you. Don't let the appearance of yourself define you. Other people are not looking at you like something is wrong. So really don't dig inside yourself. Like, continue to be you, because nothing is different about you. I am Destiny, and this is my possible.
Hi, I'm David Lawrence, and I'd like to first thank you for joining us at Discover Your Possible this year. A little bit different than last year, and hopefully different than next year. We'll get back and doing this together. But in the meantime, one of the difficult things is to stay connected, stay exercising during this time period. So, and to do that, I'm going to give you some ideas today of ways without a gymnasium, without equipment, that you can really use your own body as a weight and do an exercise that's very functional, useful to you, and can give you a full body workout. A couple things that are important about this. We're going to be getting on and off of the floor. This is not a training video on how to do that. If you need to know that information, no problem. You just go to our YouTube channel at youtube.com/missiongate, and then scroll down to our prosthetic training series. That series will have a section in there on prosthetic training, or on floor transfers, on doing transfers. So that will teach you everything you need to know. We're going to make the assumption that you know how to transfer on and off of the floor for this exercise video. Second thing I want you to know is if you have any pain in the residual limb with any of your exercises, I want you to stop. If you're doing something and 80% of the movements are fine, but one kind of bothers your leg, don't do that particular movement. There should not be pain in your residual limb while you're doing these exercises. And the last thing is you happen to be a below the knee amputee and you have a sleeve suspension. That's a vacuum system. You don't want to kneel on that system. You will cut the silicone potentially or the material and create a lack of vacuum or lack of suction to hold your prosthetic on. So if you're in that case, you only want to kneel on the sound knee when you go up and down, not onto the prosthetic side. All right? So let's get started. What we're going to do is start with very basic. We're in a very solid chair, armchair. And all I'm going to do, Keith, moving forward for us, bringing that prosthetic back underneath and come down onto your prosthetic knee. Perfect. Right onto your hands and knees. There you go. Right there. That unto itself is a bit of an exercise. So Keith, all I want you to do is then turn back towards the chair, put your hands on the chair, and use the chair to help you get back up, press up, and step and sit back down in the chair. All right, now that unto itself can be a great exercise. You do that once, it might be enough. You can see if you can do 2 times, see if you can do 3. Work your way up to 10 times, just getting down and getting back up. Practice going to one side and then to the other. See if you can do it both directions. That's enough. That's an exercise for you, then that's fantastic. If we want to make it a little more difficult, Keith, I'm going to have you come forward in the chair, come down on your knee, the exact same position. This time all the way out flat. So you're going to stretch those legs out straight and come all the way flat to the floor. All right, from that position, again, you've got yourself into a position, and even if, say, you have fallen and gone down and didn't realize, this is where you might end up. How do you get yourself back up? Well, you press back up onto all fours. Come on all the way up on all fours. Step that sound leg forward. There you go. Use the chair as a support since it's close by. Press up and just turn this direction and have a seat. Again, same thing. 1 or 2 reps might be good, but don't be afraid to go ahead and see every week or every couple of days, can I progress that? Get a few more reps out of that. Or can I do it twice to the right side, twice to the left side, and kind of go back and forth? That's fantastic. But let's just say you have a little more energy and you want to go a little bit farther with this. We're still going to start from in the chair, but Keith, I'm going to have you come forward. We're going to come right back down into the same position, all the way flush onto the floor. And from this position, Keith can bring his hands back and do basically a kneeling push-up. So just press up from this position, knee, elbows out straight, good. And then just repeat a couple of reps there. Up and down, just doing a press-up. He's bringing now his arms into the equation from the same position he was already in. From there, Keith, push back into the hands and knees. Position, knee forward, step that sound limb forward. Now, to get up, he can use a 3-point stance, hand on the knee, hand on the floor, to press and push up and see if he can get up without the chair. And he says, yeah, that doesn't feel too bad. I can still get up and I can get up without the chair. Keith could do that same thing multiple times. But I'm going to move the chair back because we're going to now add a couple of the different equations into this. But remember, it can be simple, and if you're really doing good, it can progress from there. So Keith, I'm going to have you go from here straight down onto the floor. There you go. He kicks back, comes down on that prosthetic knee, always the most stable thing to do, especially an above knee amputee, all the way down flush to the ground. Good. Keith, I want you to turn onto your left side, facing away from me. Beautiful. So he can roll onto his side, stretch your leg out straight, so he gets himself in a nice straight parallel position. Push down to the ground with your residual limb and your sound limb and bring that body up into a plank position. And once he's here, he's got his abs really tight, he's working hard, he's got his residual limb kicking into the outside of the socket, stabilizing with his sound limb, kind of holding that position. 5 seconds, 10 seconds, 30 seconds, whatever you want, it really doesn't matter. But let's say, come on back down, Keith. From that position, he can roll all the way to his other side, so I'll just have you kind of roll all the way over, and do the same thing from this side. He presses down, lifts up, abs are tight, shoulder muscles, so he's kind of holding that shoulder girdle down tight and stabilized. He doesn't want to let that shoulder come up into his ear where he can hurt his shoulder, but he's really getting a good core workout. Again, 5 seconds is great, but maybe you can go to 10 or 15, maybe even 30. Come back down, and then from there, Keith, I'm going to have you roll onto your back. And from this same move, you're still just on the floor, you can come into a position where you can do some crunchers. So abs tight, slide your fingers towards the tops of your knees, and back down. That's all you're doing, just up and down. Let's just say 5 times of crunching up and down. I don't like full sit-ups, a little hard on your back. I think you get a much better isolated workout of your abs right from this position. One more. Beautiful. From there, you'd roll back onto your hands and knees. Press all the way back up to standing. Again, he does the 3-point, presses all the way up. So the idea is that once you're on the ground, you can go straight up and down, but you can also do some different activities on the ground that bring in more core muscles, more arm action, different types of function. So what I'm going to have you do, Keith, now is a couple of times in a row, just straight coming down all the way onto your stomach, from hands and knees, stomach, all the way flat, and come right back up. So there, all the way flush, and right back up again. Press, up, step, push, and repeat. Good. Now, back in the day, our football coaches used to call this up downs. You're getting all the way down and then pushing your way all the way back up. Good, stop there. He could do that, again, 10 times in a row. Trust me, that'll be a workout. If you want it to be more of a workout, go faster. If you pick up the pace, you see how quickly can I go up and down. But now if we put in a bit of a mixed workout, we're going to put a few things together for a few reps in a row so you can see it all come together. So one more time all the way down. Good. All the way out flat, but this time we go into that push-up position. You go right into 5 push-ups. So he's pressing that kneeling push-up, press up and do 5 in a row. 2, 3, 4, 5. Now come right back up to standing. Beautiful. As soon as you're up and you feel in control, you're right back down again. Good. All the way flush and come right onto your right side. Good. Go right into that plank position. Up for 5, 4, 3, 2, 1. Back onto your stomach. Onto all fours. Step up. Sound leg. Press up. Beautiful. Make sure you feel stable. And come back down again. Beautiful. This time he's going to come on to his left side. Try to get stabilized as best he can, using that prosthetic limb to help himself. Press down as level, as hard as you can press with the prosthetic residual limb. 3, 2, 1. Come on down. Back to neutral. Back up. All fours. Step forward. Press up. And stable. Last one, because we're wearing them out. We're going to come down. Level. Press all the way to the ground. This time you're going to roll to your back. Go right into the cruncher position. 5 reps. 1, 2, 3, 4, 5. Right back to your stomach. Onto the hands and knees. Press up, foot up, all the way up tall. Excellent. Good. So, Keith will tell you right now, that's a bit of a workout. You get moving and do all those things back to back. Now, you can take your time with it. You don't have to move that quickly. The idea with any of these things is start simple, see how it goes. If you have success, build up either the speed of what you're doing or the types of things you're adding to the equation. You may just do straight up downs from the chair and just think, could I do that faster and faster? Great. And if I say I want to add more, I can add a plank. I can add a cruncher. I can add kneeling push-ups. Lots of different factors from that position can all be incorporated together. You don't need any equipment. You can do it at home. The only reason you wouldn't do something is if you're getting residual limb pain. You don't want to kneel on that sleeve. Remember, if you have a below knee amputation, and if you need some training, go to those prosthetic training videos on our YouTube channel, and you can find more information. I hope this helps it out. I hope it keeps you moving. I hope it gets you down onto the floor and off the floor, which is, again, a functional move for you, but at the same point, an exercise, and keeps you connected with what we're doing here and what you need to do to keep yourself safe and healthy. Best of luck.
Hey, good day. This is Hunter Lehman with Sportable. I am the Executive Director, and I guess welcome to Discover Your Possible, the 2020 COVID edition. So coming at you a little bit differently than we were able to connect last year, but really happy to be together. And frankly, I just want to take an opportunity before I start speaking to thank all the wonderful people that made this possible. Dave Lawrence and his team at Mission Gait, the Hanger Clinics for their support again. COSI Talks, who have been a great partner in this. We would be remiss not to thank Robin Yoder, who is one of our athletes and is a driving force, to say the least. And just everyone behind the scenes that is making this opportunity possible this year. You know, it's a bummer, like a lot of things this year, it's a lot different. We can't come together, but the opportunity to be able to share information and hopefully for people to get some value out of this is really awesome. So again, Hunter Lehman was Sportable. I'm really thankful for the opportunity for us to be able to be a part of this again this year. Last year, we were part of the event. We were actually out in the parking lot, and we were able to get people in various adaptive sports equipment and get them active, and it was a great experience. This year, I guess we're going to just tell you a little bit more about who we are, what we do, and maybe some of the things that could help you in your journey to become more active. Sportable is an adaptive sports organization. We're located here in Richmond, Virginia, the world's largest small town, as I'm fond of saying. Sportable is an adaptive sports club. When I typically am out in the community talking, the easiest thing to tell people is that we serve 3 types of people. We serve wheelchair users, amputee, and those with visual impairments. That's the population we serve. Our youngest athlete is 3. Our oldest athlete is 83. So it's a pretty wide spectrum, and it's also a really wide range of ability levels. We've been doing that work here in the Richmond area since 2005, so this is our 15th year. Our work is really important, and it's important for a variety of reasons, right? I mean, health and wellness, physical activity, exercise, all those things are important for a lot of documented reasons. For the population we serve, you know, the physical activity and the exercise component tends to lead to more independence. It reduces the social isolation factor, it reduces depression. I think that's very, very important for the population that we serve.
It creates a social network, and a lot of times not just for the athletes, but also for the parents, particularly of the youth athletes that we serve. You're talking about a lot of families that are going through a lot of the same trials and tribulations. So to create that social network, there's a lot of value in that. We have found through surveys and through research that our athletes tend to be more connected to their community. That's a huge value, I think, to our programming. Particularly on the youth side, we tend to teach and hopefully kids acquire skills that they will use in their daily living, like in their everyday life. So it's a skill they can take with them forever. And that is, I mean, frankly, that's awesome. To be able to see that as a result of the programming that we offer. Long term, I think any kind of physical activity, it reduces the chance of medical complications from lack of mobility. And we see that at every age. And we've actually seen that quite a bit with our walking program, although it's relatively new. Just to see those individuals get out and get that exercise, there's going to be a lot of long-term benefits in terms of their quality of life, as well as the social indications. It also does a lot to throw off chronic pain, so we can reduce that or reduce the onset of that. So from a medical standpoint, it's really awesome. Frankly, it's an opportunity for exercise. So for the athletes that we serve, 95% of those athletes don't have the opportunity to compete in organized sports without us. So we're kind of a one-stop shop for a lot of those folks. So it's really important. And then finally, I would say inclusion. I mean, inclusion is really, it's important. Here in Richmond, Virginia, we're a very big sports town. And, you know, we have pushed as a community to become a very active town, you know, just trying to be on the forefront of kind of the health and wellness movement. That's been, it's really spearheaded by a group called the Sports Backers here, which is the Sports Commission. But you see it just in terms of the daily exercise routines of a lot of our citizens, how active we are through parks and recs, and through our parks, through our river downtown. And we think our mission is really important because if we're going to be an active community, we have to be an active community for everyone. And that includes all citizens. And I feel like our work is really important because we provide that opportunity to folks that wouldn't otherwise have it. So it's important not only for our population, but I think for our community. So that's a little bit about our work and about Sportable and why what we do is important. Now to talk about you and maybe what you can do to become more active in your communities. So hopefully there's an organization like us in your community, but to the extent there isn't, there are probably resources for you to take advantage of. One of the first things you can do is reach out to your medical professionals. That's one of the things that we do. We reach out to the hanger clinics of the world, and we reach out to therapeutic practices. We reach out to orthopedic facilities. We reach out to any kind of a rehab facility. We need to make sure that the occupational therapists and the recreational therapists know about our services, because then they can pass it on to their clients and to their parents and to all their patients. It's really important that they know. Because they're a good source of resources, or they're a good source of identifying athletes. They're also a great source for volunteers. So we're very active in that community. So you can start there. In a lot of communities, parks and rec departments are very in tune to the needs of adaptive recreation opportunities. Here, I would say at the forefront of that, Chesterfield and Henrico are becoming a lot more in tune with that. The city of Richmond is a great partner for us, but all those folks know about our services. They can refer them. Chances are in your community, your parks and recs folks will know folks too. The YMCA, which is a great partner for us here locally, they've obviously got locations all over the country. They've been a great partner, and chances are they've got programming options that are adaptive. And then finally, at least in our community, we've had a lot of success with our children's hospital and then also the rehabilitation hospital that is here. And the rehabilitation hospital here is relatively new, but there's been a rehabilitation medical group called Sheltering Arms that has been here for a long time. But going specifically to those groups, and then kind of similar to that, to the therapist on the first point, but just making sure that you talk to the folks that are in the know so that they can understand what resources might be around. On a national level, there's a group called Move United that is a leader in adaptive sports, and you can go to their website, Move United. You can find other clubs and other organizations that might offer services in your neighborhood. The USOPC is a great resource, and they also have various clubs that are identified, that are affiliated with the national group. And then finally, you know, of those 13 core programs that we offer, virtually all of them have national governing bodies. Listen, a 20-minute Google search on your computer, you can find national governing bodies, you can find adaptive resources. You know, just off the top of my head, the Quad Rugby Association, the Wheelchair Basketball Association, U.S. Track and Field, U.S. Swimming, all of those groups have resources for adaptive athletes. And that's a big thing. And then my last point is this, is that around me, I'm here in our Sportable office, you can see tons of adaptive equipment. So equipment tends to be a big barrier, especially for first-time athletes. They're coming into a new setting. You know, one thing about adaptive sports is that you need adaptive equipment to have a safe, fulfilling, and just a really good experience. There are some organizations, you know, hopefully you can find a local organization that will let you try equipment, but to the extent that you need to source your own, you'll find that it's very expensive. However, we have found that the Challenged Athlete Foundation, which is a group I believe out of California, they provide opportunities where you can apply for funding to get your own equipment. We've also had a lot of success with the Kelly Brush Foundation. Now, Kelly Brush, I believe, tends to focus on SCI, which is spinal cord injuries. There's also the Nielsen Foundation, which also specializes in spinal cord injuries. But there are other resources for identifying equipment needs that you can find. And again, a Google search might even lead more for you, particularly from your community foundation or from a local network that coordinates philanthropic opportunities in your communities. So there's lots of information out there. Hopefully this has been somewhat helpful. If you'd like to learn more about our organization, what we offer, you can go to sportable.org. You can see more information about all of our programs. And I'd be more than happy for you to reach out. My contact information is directly on our website. Shoot me an email, whether it's me or someone on my staff. Would be happy to answer any questions and hopefully point you in the right direction in order to get active, get healthy, and put you on the path towards a better lifestyle. So again, my name is Hunter Lehman with Sportable. I appreciate the opportunity. Thanks again to everybody that made this possible. And hopefully I'll be able to see you in person in 2021. Thanks so much.
Hi, I'm Carol. I'm a bilateral below-the-knee amputee, and I love to golf. My life as an amputee actually started in July of 2017, when we had just moved to Richmond, Virginia from Oregon. We had only been here for 8 days, and I ended up having an aorta aneurysm and dissection. Ended up in the hospital for 42 days in cardiac intensive care unit with this aorta aneurysm. 8 days after my aorta aneurysm, I ended up having a condition called DIC, in which the blood in my body, the circulation, shut off and cut the blood flow off to my toes and my legs. And I ended up having, for a second time to save my life, had my legs cut below my knees. So I am a bilateral below the knee amputee. My rehabilitation process started with an in-home physical therapist at home in my hospital bed. I had to do core exercises. I continued with these for 40 days. At the end of the 40 days, I was strong enough in my core and my thighs and my butt to be able to go to the outpatient clinic for physical therapy. I worked with the outpatient physical therapist for months on end. I would start 3 times a week. We would do walking for just bare minimum of 15 feet to begin with, and then that would be enough. I had to protect the bottom of my limbs. Very, very important. I'd go home and work on the physical therapy exercises at home in between sessions. So anyway, after 6 months, I was able to use one cane and transition to no canes. Very important, but it did take me at least 6 months. And as far as the golf course, getting back to the golf course, I went from October, starting with my legs, to the end of February, being able to swing a golf club for the first time. Going back to the golf course, I had to work on my core. That was very, very important. I had to be able to work on standing and balance, being able to twist my body, being able to move my feet, being able to go upstairs, downstairs, backwards, forwards, lifting my leg, then also being able to walk on uneven surfaces. It isn't just walking on a wooden floor in a physical therapist's office. You have to learn how to navigate in your own home. You have to navigate on asphalt, cement, grass, and grass of different levels. You have short grass and long grass, thick grass and thin grass. So you want to build up as much of your muscle as you can in order to be able to walk on a golf course before you can ever hit a golf ball. Very, very important. There are a couple of major modifications that I had to do in order to play golf. The first one was I needed to take lessons so I would learn how to swing properly, because when you are an amputee, especially a bilateral below the knee, you cannot twist at your waist the way you were able to twist before. So my golf swing ends up being a lot more of my arm shots, swinging with my arms, and less twist. I also found that instead of standing straight forward, I had to turn my left foot left out towards the course. So that would give me a little more rotation of my body. And that's a very important part of the golf swing. So when I swing, I take my clubs up, my left foot is out to the left, and I try and swing and twist as much as I can to do a good follow through. That's one part. The second part is my golf cart. I have to use a golf cart because I can no longer walk the entire course. The advice that I would give to a new amputee is, first of all, keep a positive attitude. If you don't keep your positive attitude up, you're going to sink into a dark area that you don't want to be in. That's the first part, positivity. Second part, you need determination and self-will. And you need to feel good about yourself in your new situation. No one wants to be an amputee. That is the last thing in the world that anyone wants. But you have to realize this is a new part of your life, and you can overcome it with strength, positivity, and determination. And for me, with God, because God and the many prayers that I had and my family were all parts of the process that were so very, very important to my healing. And you also need a fabulous physical therapist and a fabulous prosthetic, because the two of them need to work closely together in order to make the perfect prosthetic for you and to teach you how to walk once again and to balance once again. So that is my advice. Keep your spirits up. Have your moments of pity parties, but then pick yourself back up by the bootstraps, put your amputated leg back on when you get it, and walk and do it. Or be in your wheelchair and strengthen yourself with your core exercises until you can get to the next level. I'm Carol, and this is my possible.
And been inspired.
Go.
As inspired as I am, I think it's really exciting, this information and the things that are coming at you this morning, kind of fast and furious, but again, stuff that you can get on a recording later too, to go back and look at another time. We really hope you've been inspired, encouraged, and really given a solid opportunity to move forward with a couple of ideas to keep yourself engaged, to keep yourself active, and keep yourself connected. There is lots of things that Kosi went over earlier, but I love the idea of kind of breaking things down to simple. Don't think too big. Think about something simple you could grab onto and you could try, at least if you can build confidence in that way. When I worked for years with Disabled Sports USA, I loved their tagline, if I can do this, I can do anything. So if I can start to get on and off the floor one time, if I could do 10 push-ups, if I could go for a walk with my spouse, I could go to the bathroom for myself. Those are things that are going to build confidence that you can move forward with. So we really want you to take that and move forward with it. What is Mission Gait? Mission Gait is about opportunities. It's about creating opportunities like this, like Discover Your Possible. What is possible for you? Kosi also mentioned some things out there when you were identifying, I guess, during her section of what's a problem area for you? What's something that is not going well? Check out our videos on Mission Gait. We have lots of videos. If you're having trouble and not getting that information you need, see if there's a video already out there for you. If there's not, let us know. We'd be happy to take suggestions from you and create videos specific to something you think is a problem. Again, we are just tip of the iceberg on our ideas of where we want to go with our resource library, our instructors library, all the information we out there on the YouTube channel. So those are things that are out there for you, and Mission Gait is here for you, empowering the healthcare community, the rehab community with education, training, and research to help those with complex movement disabilities to overcome that daily obstacles or those daily obstacles. Of course, we have to thank our sponsors, our partners, our generous donors, folks that have really made a difference and made it possible for us to do this today. Hope you enjoyed their commercials. I think they were inspiring as well, but really appreciate everything that they're doing for us. Now, really important, stay connected, right? During this time in particular, where we have to do this virtually, stay connected virtually. Everything through our Facebook, through Twitter, through the YouTube channel, go to our website, missiongait.org. You can, all these ways, stay connected. All those things are listed on your screen. See and get connected and stay connected. Send us information, we'll get information back to you. Next steps for you, don't forget, we're not done yet. At 1 o'clock today, we have our Zoom meetings, our Zoom groups for amputees and clinicians, right? You want to stay connected for that. If you haven't registered and you would like to attend, you still can, no problem. Just go to our missiongait.org website, and there's an orange banner at the top. Click on that banner, and then you can register and get connected. But make sure at 1 o'clock you're here for the Zoom meetings. Those Zoom meetings are going to be giving you that opportunity to ask some direct questions to clinicians and hopefully get some direct and good dialogue back and forth between all of us. Again, I hope you've enjoyed the morning. I think it's been fantastic, and we really look forward to seeing you this afternoon with our Zoom meetings.
Yeah.
You better come on, we got 7 seconds.
I've never been in a firehouse before.
Never been in a firehouse?
No. It's pretty cool. It's pretty cool.
When you have a therapist that tells you to squeeze a penny between your butt cheeks and walk and squish bugs at the same time, it's very difficult.
Discover Your Possible is only 1 day away. Make sure to register by going to missiongait.org and clicking the link at the top of the page.
The most energy I've ever put in a video.
Do it again.
How can I work?
I'm sorry, Will.
Oh my goodness, Tracy.
I'm so sorry.
Bless you.
Did you see the faces I was making, Dave? I was trying so hard.
I thought it was empathy for what I was saying. I didn't know.